Auzubillahi minash shaitanir rajim. Bismillahir rahmanir rahim. Assalamu alaikum. Ji ayanu pakhair agale ni hao chunashumme washmale ohai gonzaimus guten morgen. Hola, boyor, privet, kaifa hal? Hale shuma chatore, ahlan wa sahlan, marhaba, buna, mucho, gracias, swabia, bhalli kare aaya, hosh galdin, anayo, hasayo, and thank you very much everybody for tuning into PTV World. You definitely watching World this morning. Alongside the very amazing, the very talented, and she's actually filling up for Hajar too as well. Ladies and gentlemen, let's welcome very warmly Miss Hira Mustafa. Hello Hira. Assalamu alaikum. Good morning. How are you feeling today?
Walaikum assalam, and thank you so much for such a lovely warm-up welcome that you just introduced me to the viewers of PTV
You
World.
deserve it.
Yes, and my day just started like, on a roller coaster ride. I'm feeling very overwhelmed and overjoyed at the moment that I'm joining Shehzad Khan,
Thank you so
one
much.
of the lively hosts of our morning show.
Wow, that's wonderful. You did it. You nailed it. I think that you're going to be great too as well. Thank you very much for joining us on such a short notice. But other than that, we hope and pray that everybody out there is ready to kickstart their day with us. And it's, ladies and gentlemen, a very amazing day over here in Islamabad. I think that the weather actually calls for probably going out for a pakora or a gurwali chai and something of that sort
The weather is
as
really
well.
lively since the morning, and it's been raining, I think, since yesterday.
Yes, it's been raining as well, and monsoon rains, yes, the spell, ladies and gentlemen, has been going on for a longer period compared to the previous year as well. But first things first, I think what we really need to do is look into what's happening inside the country and then outside the country. So first up, the top stories. Hira, you ready?
Yeah,
all right,
I'm ready.
So the top stories we've picked up for our audiences in 46 different countries, ladies and gentlemen. The first one says, Pakistan Army troops are assisting civil administration and rescue and relief efforts in flood-affected areas of Balochistan and Gilgit-Baltistan. Just the very thing I was mentioning before. Pakistan Army and FC Balochistan emergency response teams are constantly busy in dewatering, supplying basic food necessities and medical care to affected population. Water is being drained from the affected areas through dewatering pumps and the tankers. More than 700 families trapped during floods in Bolan, Lasbela, Othal and Jhalmaksi and Khizar were shifted to safe places. I'm glad that all of the families were able to make it out alive. Alhamdulillah, thanks to all of those law enforcing agencies who are actually out there helping all of these stranded families. Thank you very much, Pak Fauj. You've always been great. You've always been looking after the nation. Thank you very much once again, and we are highly indebted. Moving on.
Yeah, moving on now, we're going to talk about sports. So we're going to talk about Scrabble Championship that is taking place at the moment. And Pakistan's Wasim Khatri stormed into the final of the Scrabble Players Championship being played in Baltimore. Wasim is playing in the international division of this prime North American Championship featuring around 400 players. He finished day 4 of the championship with 19 wins out of 28 games and qualified to play the best of 5 final against Austin Shin of England. Both Wasim and Austin Shin ended up with 19 wins. Matthew Tunnicliffe of Canada was third. Well, that's a great achievement for Pakistan, a pride for our country.
Exactly, it's great. Keep up the good work. Yes, what about you, Hira? Are you good at Scrabble? Are you good at guessing?
Yeah, I'm just like keep on guessing in this show, like what's going to happen next. So,
all right, so next one, obviously, towards the end of the news we wanted to share with you guys. Ladies and gentlemen, it is a very important day today, and it's because of the fact that millions of lives every year have been lost just because of this very illness, which still exists within the society. We can take a lot of initiatives with which we can save millions of lives all over the globe, and for that, I think we really need to share this update with you because today, all over the world, World Hepatitis Day is being observed, and when we talk about hepatitis, ladies and gentlemen, a few refer to it as a silent killer as well. But World Hepatitis Day is being observed today to increase awareness and understanding about viral hepatitis and the disease causes due to it. This year's theme for World Hepatitis Day is bringing hepatitis care closer to you. The idea of this theme is to focus on raising awareness of the need to make hepatitis care more accessible. The date of 28 July was chosen because it is the birthday of Nobel Prize winning scientist Dr. Baruch Blumberg, who discovered hepatitis B virus and developed a diagnostic test and vaccine for the virus. Wow. I mean, I wonder, one day probably, we have the names of our Pakistani people who have actually kind of figured out a way probably for cancer, blood cancer, different diseases as well. And if we achieve that, that's a milestone, which I truly want Pakistan to do that, invest a lot of money in research too as well, where we are giving those platforms where rather than looking at the West for the testing and, treatments, I think, our doctors over here are capable, they're world renowned as well, given the facility, we can certainly achieve this target and goal too as well. Now, coming down to what we are talking about, since it happens to be World Hepatitis Day, and I mentioned more than millions of lives have been lost just because of this cause. A lot of millions of people are living with the condition as well. There are 5 different types, talking about them, A, B, C, D, and E. We certainly want to delve into it, nosedive into it, because we're very lucky that we've been joined by a panel. People might wish to kind of talk to, because when it comes down to hepatitis, ladies and gentlemen, it's a silent killer. I have mentioned it before too as well. So to get started, I'm going to introduce my guest over here. So first up, we're very lucky that we've actually been joined with somebody who happens to be the Vice Chancellor for Medical University, Rawalpindi. He's a consultant gastroenterologist. He is Professor Muhammad Umar Saab. Hello, sir. Assalamu alaikum. Good morning.
Oh, walaikum salam. Thank you very much for invitation.
Thank you very much, sir, for joining us. And you look lovely, mashallah, sir. Thank you very much for dressing up for our show. I think we are highly indebted. That's usually how doctors do dress up too as well. Alongside Professor Saab, we're very lucky that we've actually been joined by somebody who happens to be the Secretary General STEP gastroenterologist. He is Dr. Zahid Mahmood Minhas Saab. Hello, sir. Assalamu alaikum.
Walaikum salam.
Finally, we have you over here in the studios.
Thank you very much, sir, for inviting and celebrating this day, because this is a very important day today.
Yeah,
It is.
indeed it is.
And
Indeed
rather
it
than
is.
celebration, I think observing is better, because it's an illness, and
Yeah.
people certainly have to go through quite a lot of trouble, treatments, challenges. We will come down to that, but now I think it's our time that we introduce the leader of this clan. Ladies and gentlemen, we're very lucky that we've been joined by somebody who happens to be a consultant gastroenterologist for Quaid-e-Azam International Hospital. He is Brigadier Retired Mr. Amjad Salamat Saab. Hello, sir. Assalamu alaikum. Subha bakhair.
Thank you very much. Thank you very much for the invite.
Thank you very much. This is, I think, probably the second time in my life that I've heard somebody's vocal bass being just around how I am. So thank you very much once again
Thank
for
you for
joining
joining us.
And last but not the least, we're very lucky that we've been joined by somebody who happens to be a senior registrar at Holy Family Hospital. He's a gastroenterologist. He is Dr. Tayyib Saeed Akhtar Saab. Hello, sir. Assalamu alaikum.
Walaikum salam. Thank you very much for.
Thank you very much for
inviting.
joining us. First things first, obviously, I want each and every one of you to kind of talk about how important it is to observe this day. What are we looking forward to, and what are the conditions as of now? So individually, sir, let's start with you.
Bismillah ar-Rahman ar-Rahim. Once again, I am very thankful to PTV and particularly both of you
Thank you very much.
for highlighting this issue of hepatitis.
Thank you, sir.
I think the world has become the global village, and I always used to see and talk to my students that the disease and knowledge has no boundaries.
True.
And COVID has proved this, that there is no discrimination between rich and poor, Muslim or non-Muslim, black or white. When the disease comes, they come as a disease.
True.
So there should be a collaborative approach. There should be a global approach, and to control these diseases, prevent these diseases, and treat these viruses. So I think today is the day which is globally observed for the hepatitis.
Exactly, and it feels wonderful. So imagine, each and every individual who's present over here comes from a very different background of their hospital and the people they have been serving. And, I think that they have very rightfully mentioned over here that everybody needs to collaborate to kind of fight this illness or menace as well. Now, moving on to you, sir. Now, what I wanted to ask you was that, since this year's theme is bringing hepatitis care closer to you, do you think that we have been successful in making sure that, people who really needed the treatment in time got it in time rather than delayed?
Unfortunately, simple answer, no.
Okay, very sorry.
Because actually the disease burden is too much in our country. Resources are meager,
Right.
education is very low, and the commitment level which is required to control this disease, because this is a disease which can be prevented.
True,
The thing which can be prevented, it is better to prevent rather to treat.
true. So, which is why I think it's about time that I asked Brigadier Sahab over here. So, Brigadier Sahab, how many people over in Pakistan, if you know it roughly, actually suffer from any sort of hepatitis in the first place? And then, sir has very rightfully mentioned that we really need to kind of do our own research and make sure that we reach out to people. Are we planning on that?
A very relevant question. Thank you. I think the overall prevalence of the disease is approximately it's about 4% for the hepatitis C, and
Right.
it's about slightly getting better in hepatitis C, 2 to 3%. Having said that, however, there's a caveat to that, is that in certain areas, this prevalence can actually reach 30%. And so that's like 3 out of every 10, and that's an appalling situation. And another fact worth mentioning is that, in fact, in the last few years, the prevalence and incidence of hepatitis C has increased in Punjab province rather than decreased.
All right.
Oh my God.
So if you extrapolate the 4% to the whole population, you can get a picture of what
So we need
happens.
to take immediate steps in order to curb this disease, right?
Yeah, so I think the prevention is the way to go.
But
Exactly.
we have always been talking about it as well. Sorry, Hira, that I'm barging in as well. But even last year when we were observing the same day, that's the exact conversation that we had. That how are we actually going to make sure that we're going to prevent it. Moving on towards prevention, I'm very sorry, Saib, that I'm going to put you under the spotlight, but it's because of the fact that I've had experiences of going to Holy Family, for example. Now, when we talk about hepatitis A and E, these are viral diseases, and you can get it too as well. I've seen a lot of people not wearing masks. I've seen a lot of people, sweating. Probably people pushing in the queue too as well. So, if the hospitals are not focused on making sure that somebody else does not get this disease, how are we even going to make sure that we are going to bring the care closer to people living with hepatitis, please?
Yes, definitely. As all the panelists are saying that prevention is better than cure, and you have rightly pointed out that it's all about generating awareness, and this is what we are celebrating this day for. Hepatitis A and E, it's basically one group, and B and C is the second group. So the spread is slightly different, and A and E, that basically has a spread that is through the fecal-oral route. So that needs a good hand hygiene, more
Something which COVID has
cleanliness.
taught us.
Yes, and you have to have some good water, boiling water, and some clean food. But on the other hand, the BC is that is a more serious dilemma.
Lethal.
The hospitals have to have more strict measures for that, because the contaminated needles, the equipment, and when you come to the community, especially going to the barbers, they can the beauticians, the tattooing, the blood products, all these things can spread the disease. So it's all about awareness. People are getting more and more aware, but with the passage of time, we can expect that things can improve. But
It's already 2022. We're living in 2022. The world has actually gone beyond our reach too as well. But yes, you're right. We have to start somewhere, and today might be that day, because when we observe such days, it's all about a ripple effect. Just like you throw a stone into the river or water, and you see these ripples coming back to you. But I'm going to come back to you, Professor Saab. Now, let's start with how each and every one of you has mentioned that prevention is better than cure. And I totally believe it too as well. But how do we prevent when people do not have a habit of testing, going to the doctor, not getting themselves checked up? We are habitual of, probably hugging each other, shaking hands. Apnayat nahi inko aati logon ko aksar. And we know that this menace is out there. So what and how do you refer or recommend that we really need to prevent?
I think there is always, when you have a disease which has such high prevalence, so there are always national programs.
True.
So the government and the nation take it as a challenge. And there is a national hepatitis prevention treatment control programs.
All right.
And unless we work in a very organized way, in a very focused way and sustainable way, you can't control all these infections. So what we have done, as the government has done and different organizations have done, our university has done, they identify the 5 risk factors.
All right. What are those?
Those risk factors are, particularly for hepatitis B and C, is the injection. Injudicious use of injections. They are necessary, but they are given injection, or people demand injection.
All right.
And particularly with unsterilized, unclean syringes. This is the most commonest risk factor for
going to the
transmission
barber,
of
probably.
The second is the dental treatment. Because you need sterilization, particularly the treatment which involves the deeper tissue, the equipment must be sterilized.
Okay.
The third is the transfusions. Alhamdulillah, now there is a blood transfusion authority with the Punjab government and the national government, and we are screening all the blood. But there is a time 10, 15, 20 years before. Remember, this disease may not you catch it just few weeks back.
True.
You may have 20 year back, may have a 30 year back. Now you end up with the liver disease. The blood, so this is mandatory, screening of the blood, and blood should be healthy.
It's important.
The fourth, we rightly said, is the any use of needle or pricks, as we use in the hair cutting, barber shaving, we use for the pricking the nose, piercing ears,
Right.
tattooing. So this can be the third or fourth most common cause. I think the another most important cause is the unsterilized equipment used by the doctors,
Yeah,
by
I
the
wanted to talk about
professionals during delivery in particular, gynecological procedure, obstetrics procedures, endoscopies. So all these equipment need a special sort of sterilization.
Yeah.
So if we take care of all these, I mean, you don't use unsterilized syringes, don't
Yeah.
demand for unnecessary injections, you use the screened blood, you use the proper dentist, qualified dentist who has a sterilized equipment, and we as a health professional take care of the hospital equipment or our clinic equipment for any sort of procedure, surgery, delivery or endoscopy. If it is sterilized, I guarantee you that this menace can be eliminated.
That's great, sir, that you have actually spoken about it as well and kind of taken the blame onto yourself, because for all of these 5 types you mentioned, other than one where you go to the barber or probably inject yourself, I think it's totally dependent on the doctors and the healthcare system to make sure that we do not get hepatitis. I think that's something which I would want to establish over here.
Sorry, I'm interrupting here, but I wanted to ask, like, from Dr. Tayyib, that you initially mentioned that we need to have certain campaigns for the awareness among the people. But how can we make this sure that there are certain campaigns through which people are aware about the fact that hepatitis is, prevalent in them, and how to prevent it? I mean, what are the initial stages? I mean, most of the people are unaware of the fact that they are going through hepatitis A, B, C, D. And so how can we actually look forward to that?
What are the symptoms?
Yeah.
Actually, it's a very, very good question you have raised, because especially when you talk about hepatitis B and C, these are the viruses which usually stays asymptomatic for decades. So that's why actually, when the World Hepatitis Day and all these campaigns were launched in 2016, and people started working on it.
Right.
The slogan changed from 2018, and the slogan became "Find the Missing Millions."
True.
So they soon realized that actually 9 out of 10 people don't even know that they have hepatitis B or C.
True.
So actually they are asymptomatic, and I think so this is the basic dilemma of the society. And I must tell you that with the vision of Professor Muhammad Umar, we started a campaign in Rawalpindi with the hepatitis-free Rawalpindi zone in 2019, and we started screening camps in Union Council wise. And we have our own data. More than 6% people we screened who were unaware that they were having hepatitis C.
Oh, no.
And they were asymptomatic. They were just moving about and they have no idea. So actually we have to pick them up, and they require mass screening, mass camping, and for that we have to use all our resources, including digitalization, including social media, including campaigns, including technology. So everyone have to be hand in hand, and this is how we can only achieve our goal to eliminate hepatitis by 2030.
It's great, and it obviously needs to be collective effort, and where we speak about 2030, I think World Health Organization actually recommends us to do that, which COVID has obviously delayed. Coming back to Dr. Zahid Saab over here with the same question, where we were talking about prevention. I mean, all of these campaigns Dr. Tayyib has mentioned about, and we have highlighted that 4 of the causes of all of these hepatitis is probably when you're getting treated, you're getting a treatment from a doctor, and the healthcare professions are probably being ignorant of it. I have had an example where I've seen some people, while they were in the hospital, one of those gentlemen happens to be a dentist, they were training, they wouldn't really kind of go and sterilize the equipment again. Probably the next person is there in the chair, they would use the same equipment. And I had quite a lot of an argument with that gentleman that you've been actually risking a lot of families and people out there as well. Not just that, where you spoke about transfusion, I had an example within my own household where my chachu was in an accident. The blood wasn't screened and it ended up having hepatitis and unfortunately then stroke, and then he passed away, which obviously is something that we really need to highlight, that the healthcare providers really need to think about more and more prevention and SOPs being put in place. So let's kind of delve into that prevention. How do you think healthcare providers are making sure that all of those standard operating procedures are being followed?
Sir, I will give an example of Egypt.
Okay, sir.
Egypt had,
दूर ले गए थोड़ा सा, लेकिन ठीक है.
it is actually having more prevalence in Egypt than Pakistan.
All right.
Right.
And they now have eliminated hepatitis.
Wow.
And in last 10 years, they all have done this.
And while you say that, sir,
Wonderful.
we have not been able to even eradicate polio from our country, and we are the only last two countries, Afghanistan and Pakistan, where
Yeah.
polio still exists.
And
Please.
another case has been reported from USA.
Gee. Please go on.
So this is important thing that we should see the model of Egypt, how they have controlled and prevented hepatitis,
Talk about it a little. Please share with us.
because they have made a plan with the WHO.
Okay.
All right.
They started it from the lower level, from the tehsil level. They have the centers where they have the screening camps, testing the people,
Yeah.
Right.
collecting the data, and they have a central registry system. That was all on digital media. And then they started treatment of those people who are patients, and the other people got the education. They were actually have the seminars, they have the multiple camps, and everybody was registered for that purpose. So they came from the 8% to the 1.5%.
Wow.
So if we do all these things, we have the system in Punjab,
Yeah.
PITB. We can have all the data. Almost in Punjab, it is replicating there, that they are getting the data of the people who are being screened. But we need it to do at the BHU level.
All right. And why is it not happening at that level?
I hope that there is government's planning.
All
I
right.
hope that in the near
I
future
mean, if it
we
would
might
have been
see.
government's planning, I think we would have achieved a milestone. We haven't
And-
achieved anything. You know, the cases are actually increasing. I will come back to Umar Saab over here because he's responsible for that. But let me move on to Brigadier Saab over here very quickly. Now, sir, let's talk about testing. First of all, I want you to share for people who might not have any experience of what hepatitis is, different types are, which ones are more lethal, which ones are treatable. In fact, all types are treatable, alhamdulillah, if caught in time.
Yes.
All right, so please go on. Tell us a little about that.
So all hepatitis are of course treatable.
Alhamdulillah.
A and E are usually do not have long-term effects, except in certain populations like who are immunosuppressed and others. But B and C can have consequences for a large proportion of patients who are infected.
Okay.
But I must remove a misunderstanding here that all people who will get hepatitis B and C will go on to develop chronic disease. For example, if you get in an adult population, if an adult gets a hepatitis B, only about 10% of them would actually go on to develop chronic disease. Comparing with hepatitis C, about 75 to 80% of them would actually go on to develop a chronic disease. So, having said that, so the consequences of B, C are quite high, and you will only get delta or D hepatitis if you have a hepatitis B.
All right.
So those are the consequences. But if I just take 30 seconds
Sure,
to point out,
Take all the time you want.
just to digress from the question, your question
True.
is that I have a different take on this preventive aspects,
Yeah.
preventive measures. You see, anything which happens, a disease happens, I think we have developed an understanding over a period of time that it doesn't happen isolated. There's a whole biopsychosocial environment with it. So I think if one has to eliminate, or if one has to take this endeavor at a very large level, so one has to actually look at the structural things, the whole
Structural
structure,
disobedience problem.
this whole structure which actually leads to this, and to institute a change in this structure is a big thing, and that requires a lot of resources and all those things. Dr. Zayed has mentioned this hepatitis C elimination, and this, you know why this happened actually? Because the president of Egypt actually got hepatitis C.
All right.
And then he got 28 agencies together and they put a program through.
Okay, let's do it.
Right.
So you can imagine how it
Well,
happened.
we certainly do not want our leadership to kind of, God forbid, go through that. But yes, obviously, I think they're always very mindful. And speaking about the then Chief Minister Punjab, obviously Shahbaz Sharif Sahab, who now happens to be the Prime Minister, has always been very efficient. Let's talk about all of those cancer patients which were getting medicines for free. Unfortunately, they're not getting any medicine for free now as well. So
Yeah.
there are different programs. They've always taken this initiative as well, which is wonderful. Now,
I have a question if you don't mind.
yeah,
I'm
just
sorry for
just the
bothering
last
you.
bit, just the
Okay.
last bit. So, what about the testing now, sir?
Yeah.
Because I think testing is something which is very pivotal, important.
Yeah, that's very important, because I think unless we test and know how many people are there, because if there's a threshold level in the society, if beyond a certain level, if you have a number of patients who have this disease and they don't know, they will keep on transmitting it.
All right.
To give you an idea, we treat about 2.5 million people.
year?
Two and a half,
250,000.
250,000 people every year, and we add the same amount every year. So we are not moving
Forward.
Yeah, we are where we
We're
are.
heading backwards, right?
Yeah. So that's because the reason is that why we link it to treatment is because if you treat it, the transmission stops. And if it is eliminated to a certain extent, to a number, then the transmission will stop.
All right.
Yeah.
So that's a big problem.
So then, do we need to keep people in isolation, or because
No,
you know,
no.
back in those days, people used to
No, not for hepatitis B and C.
Okay.
As I said, they're
A and E?
Yeah, A and E is of course hygiene,
All
total
right.
hygiene, water and all that. And then you can see if you have to provide clean water to the whole country,
Yeah.
you can imagine what's going to happen.
And what about D?
D only happens if you have B,
All right.
right?
So it's interlinked.
Yeah. So, but to give you an idea, what's the proportion of the things which are transmitting virus? For example, 70 to 75% of the cases who are hepatitis B and C are transmitted by injections, as Professor Umar rightly pointed out.
All right.
So, 2/3 is if you stop injections.
Okay.
About 13 injections or 14 injections are average, which is administered in Pakistan, to individuals, as compared to the world average of 1 to 2.
All right.
So 75% transmission we can stop here.
Yeah.
And then the rest of it. Interestingly, the blood banks only transmit less than 1%. All right. And the instruments, of course, 3 to 4%. So you can look at the statistics, but as you rightly pointed out, the injections are already administered by either the medical or the paramedical.
True,
This
true,
is the
true.
unregistered normal. So I think, as Professor Umar has said, if we can just do this, tell the people not take injections.
Wow. And obviously, you know, so we definitely need to come towards the treatments and the availability of the treatments as well. But just early this morning, today, all of you actually participated in a walk to raise awareness about hepatitis as well. I think it was under your auspices. We want to share the pictures too as well, and then let Umar Sahab speak about it. So, sir, do you think that such walks will have an impact, or rather putting more stricter SOPs in place will help?
I think both.
Okay.
Because this is awareness. And awareness is not only to the public in general,
Yeah.
it is the healthcare professionals. So if the healthcare professional, nurses, paramedics, as Brady Sahib said, the maximum injections are given by the paramedics,
True.
Particularly in the rural areas where the doctors are not available. So we have to wear our own healthcare professionals, and obviously we have lot of population in the hospitals. If I talk about the 3 hospitals of Rawalpindi, so we treat, there are about 8 million attendants who visit the hospital every years. So if you 8 millions people, these attendant and patients, they become the part of this campaign. They are where they can spread this message to
And they would know then,
Then
yes.
there are institutions. There are 7 universities in the 2 towns.
True.
If their staff is more than,
Aware.
if I can say more than million, they can transmit this message.
True.
So this awareness message is multifaceted.
Wow.
And the universities must be at the top. In
Exactly.
prevention and education and treatment.
And obviously,
raising
once they will know, then
Yeah,
the
that's-
people will be able to look after very well as well. With that, we actually have to head out towards a short break. When you guys will come back, I think it will be time that we start to talk about the treatments which are readily available, whether cheap, whether expensive, whether all of these hospitals are making sure that they're going to bring closer the hepatitis care too as well, and that too in terms of making sure that everybody can afford it. Is it affordable? Will be the next question. What are the treatments available? After a short break, don't go anywhere. Good morning.
died in 2 years.
Welcome back. You're watching World This Morning, and today we are observing World Hepatitis Day, and we have a short report for that. Let's have a look.
Wonderful. Yeah, we're still going.
Yeah, we're still going.
All right, I think there's a glitch in our system as well. But before we move on towards that report, let me just now come down towards where we want to talk about treatments. First up, government initiatives. Professor Saab, let's talk about all the government initiatives which have been undertaken so far, and what are you looking forward to in days to come?
Good. So this is the right question. I think let's come to the positive side also. The first PC1, if I rightly remember, was 2006, and government comprehensively thought about developing a PC1 for whole country, for all 4 provinces, and even the GB and AJK. And this was the first step taken by the government, and this was called the National Hepatitis Prevention, Control and Treatment Programs. And if I remember, I think 12 billion rupees were sanctioned at that times. And then the issue of providing free treatment. So I remember for 3-4 years we provided free treatment to each and every patient of Punjab in particular, and other provinces in general also, who visited the hospital, along with their PCR, along with their ultrasound and everything. So this is how it was started. Unfortunately, there are ups and downs, and sustainability is issue. I think even the funding is not issue. It is the sustainability of the policies. So if I have to point one thing, that is particularly when we talk of the health of human being, our citizens of Pakistan, and education, there should be no compromise and there should be no divided opinion that. Wonderful. If this would have been persistent, I guarantee you that the hepatitis would have been eradicated in at least 2024. And if we still persist with those funding and those policies and elimination program of hepatitis B and C, which was launched again in 2018 and 19 something, we can still achieve the target.
Wonderful.
Sir, since you talked about the free treatments for the hepatitis patients that are actually prone to it or suffering through it, are there any government policies still for that?
Yes, at least I can assure about the Punjab. Still, I am chief executive of the 3 hospital of Rawalpindi, and anybody
Wonderful.
can have a walk-in clinic to the hepatitis clinic. You just walk in and get tested by the free hepatitis B and C screening, as well as the PCR and other tests, and surplus drugs are available. Not a single complaint from these 3 hospitals that the drug for hepatitis B or C are not available.
And Punjab has always been at the forefront talking about, looking after the people within the province.
Because it is half of the Pakistan also.
Yeah, it is indeed.
Exactly, but I think that the other people really need to learn about it as well. But sir, Brigadier Sahab, moving on to you now, because you will definitely take us through that journey of treatments available for all different 5 types. So please, let's get started with that.
Yeah, I think I'll just simplify it. I usually sort of classify it into preventive treatment and the therapeutic. So the preventive treatment is the most important, I think. As I said, the general measures, hygienic measures to prevent A and E, especially these days, a lot of water getting contaminated, our lines getting contaminated with rains and everything. So clean water, clean food, do not take from outside, wash your hands. This is a preventive treatment for that.
Right.
But also we have hepatitis A and E vaccines, and those vaccines are not very relevant for our country, because the reason is that by the time that the child is 7, he's already got hepatitis, most of them, and they have been asymptomatic. Many of them adult population is already exposed to the E. So these patients develop long-lasting immunity once they have it, unless they're immunosuppressed, so you don't need to vaccinate them that way.
So with people who are on immunosuppressants, they really do not need the vaccine.
They do, because before that, for example, but they can develop chronic disease and we need to treat them.
Okay.
As comes to the hepatitis C, I think that's been a revolution in this. This happens rarely, but in case of hepatitis C, this has happened in our lifetime. We have seen it from being incurable to curable to getting injectables to actually very simplified treatment.
All in one lifetime.
On a lifetime. This doesn't really happen. The doctors don't see that because it happened. So it happened in 30, 35 years, and now we have a very simple treatment, one pill for 3 months, and 95% of the people are cured.
Wow.
That's
and do we
wonderful.
get that pill for free, or do we have to
Yes,
pay for
but
it?
so I think it's a very costly pill in the Western countries, but many companies like Gilead, and I think our government has been active, as Professor Umar has pointed out. This is we have get it on subsidized rates. So this treatment now only costs about 12,000 rupees or even less in certain cases for 3 months treatment, right?
Wow.
Or 6,000 sometimes. And if you get even some people who don't respond to initial treatment, very few, they can even get the second line treatment, which is very costly outside. It's almost like $100,000, but you can get it after 30 or 60,000 rupees.
Wow.
So hepatitis B, of course, is a long-term treatment, and once you have this treatment, majority of the patients would be on a single pill. Again, it's been simplified, and they will have to take it for lifetime.
So all you have to do is that just make sure that you reach the doctor in time.
Yes. So the most important thing is that you should know that you have a disease. We have effective treatments now.
Wow.
Now, wonderful. Now, Dr. Tayyab, same question to you. That is there any walk-in facility for the hepatitis patients who are suffering from that? I mean, free treatment for
At
that
Holy
in
Family.
Holy Family.
Yeah.
Yes, we have got some state of the art.
चक्कर बड़े लगवाते हैं सर फ्री के इलाज में जो आता है कभी यहाँ से पर्ची बनवाओ वहाँ जाओ यहाँ आओ.
That is because of the load we are facing. Actually, if you just look at the stats, we are number 2 in the world for hepatitis C. It's not something.
We are number 1 in diseases, number 2 in
Yeah,
diseases. I
yes,
think
this
we're
is
not
not
going to be
something
number
to
1
be,
and 2 in economy.
In fact, we are number 1 in hepatitis C.
Yes.
The reason China is above us is because they have a large number of
large
people.
population.
Unfortunately, but yes.
So that's the reason. But even then, if you compare it with all other facilities, still the patients are getting the treatment in a very sophisticated way. But I think so. The system is there. The medications are there. They are free. Brigadier Saab has very rightly pointed out. But I still believe my point is still the same. The treatment of hepatitis C is no doubt revolutionized. It's curable now. But again, it's about the missing millions, because you will be able to treat them if they know that they have the disease. Then they will come to you.
Yes.
But what about those who don't know? Because once the liver is fine, you are able to treat them and cure them. Once they don't know, and slowly they are asymptomatic and the liver is damaged,
Yeah.
and it's decompensated, and once they land with complications, and then you come to know, oh, they are suffering from hepatitis C.
True.
Then there's no fun of knowing or treating the patient. So it's
Indeed.
very important to screen them on time and,
Exactly. And I think
diagnosing.
that's a wonderful message that you've given out. I think I would want to kind of say it in Urdu as well. जो भी मेरी अभी तक डॉक्टर हजरात से कॉन्वर्सेशन हुई है उसका आपको नटशल बता देता हूँ. वो ये है कि जितने भी टाइप के मुख्तलिफ हेपेटाइटिस हैं ये सब ट्रीटेबल हैं. अगर आप टाइम पे डॉक्टर के पास चले जाते हैं, अपने टेस्ट कराते हैं, आप डिनाइल में नहीं रहते, आप ये नहीं सोचते कि नहीं मुझे कुछ नहीं हुआ, तो आई थिंक बेहतरीन यही होता है कि साल में 2 दफ़ा वैसे भी जाके आप अपने टेस्ट कराया करें. मैं ये बार बार रेकमेंड करता हूँ सब लोगों को, क्योंकि ताकि खुदा न खास्ता आप अपने आप को किसी हादसे से बचा सकें. और प्रोफेसर उमर साहब ने भी यहाँ पे ये बात मेंशन की कि 3 अस्पताल जिनको ये सुपरवाइज कर रहे हैं, देख रहे हैं, इनकी सरबराही में चल रहे हैं, उसमें आप जाएं, फ्री टेस्ट होंगे, आपको दवाइयाँ फ्री मिलेंगी, इलाज मुआवजा फ्री होगा. लेकिन उसके लिए ज़रूरी है कि आपको पता हो कि आप किस बीमारी से गुजर रहे हैं. राइट नाउ वी एक्चुअली हैव अ स्मॉल रिपोर्ट ऑन टू शेयर ऑन वर्ल्ड हेपेटाइटिस डे एज वेल. गो अहेड, टेक अ लुक एट दैट. When you guys will come back, I have a question for Brigadier Saab where I want to ask about liver transplant and the facility we have in Pakistan, and then towards the end we will take messages from each and every individual over here. Let's go, let's take a look.
World Hepatitis Day is observed each year on the 28th of July to raise awareness of viral hepatitis, which causes inflammation of the liver that leads to severe disease and liver cancer. The world is currently facing a new outbreak of unexplained acute hepatitis infections affecting children. Scientists and policymakers in affected countries are working to understand the cause of this infection that doesn't appear to belong to any of the 5 types of hepatitis viruses: A, B, C, D, and E. This new outbreak causes mild disease and even goes undetected. but in some cases they can lead to complications and can be fatal. Global efforts prioritize the elimination of the hepatitis B, C, and D infections. Unlike acute viral hepatitis, these three infections cause chronic hepatitis that lasts for several decades and culminate in over 1 million deaths per year from cirrhosis and liver cancer, according to WHO. These three types of chronic hepatitis infections are responsible for over 95% of hepatitis deaths. While we have the guidance and tools to diagnose, treat, and prevent chronic viral hepatitis, these services are often out of reach of communities and are sometimes only available at centralized or specialized hospitals. WHO aims to achieve hepatitis elimination by 2030. To get there, WHO calls on countries to achieve specific targets. That's reducing new infections of hepatitis B and C by 90%, reducing hepatitis-related deaths from liver cirrhosis and cancer by 65%, ensuring that at least 90% of people with hepatitis B and C virus are diagnosed, and ensuring that at least 80% of those eligible receive appropriate treatment. It's need of the hour to bring hepatitis care closer to the primary health facilities and communities so that the people have better access to treatment and care, so together we can eliminate this disease out of our lives.
All right, yes, that was a small report, ladies and gentlemen. And while you guys were actually looking at the report, we were talking about treatments too as well. Since we are very short on time, so I would want each and every individual who's taken out time on such an important day to please say their heart out. So, sir, whatever you want to say, this will be your camera. People in 46 different countries are looking and listening at you.
My very simple message is, please get yourself tested and your family tested for hepatitis B and C. Thank you.
And those tests are for free. Let me reiterate that too as well. Sir, please.
I will continue with the message of Professor Umar. Get tested, and if you are positive, go to a doctor, get the treatment. Very cheap and easy treatment is available for hepatitis C.
And it's curable also.
And it
so
is
no need to worry.
95% curable.
Wow, wonderful. Sir.
I think I would reiterate that and also say that unfortunately, if you are at the end of it, then we are the guys you should be looking for. We'd also, as he has mentioned, we'd like we can actually provide even advanced cases, services like transplant and all these things.
Wow.
But I think again, emphasizing again and again, test and you have the treatment.
Wow, that's wonderful. Sir, sir.
My message is that as the world is fighting against hepatitis and they want to eliminate it by 2030, we should be participating in the same race with the same targets. And I think so, if we want to win this race and achieve the target, one important thing is that we should do it with the help of technology and digitalization. And we have also launched HepRx, which is one of the digital platform. And without technology, we cannot fight this deadly disease.
Wow, wonderful. Thank you very much, gentlemen, for being with us. Thank you very much for taking our time to make sure that you're going to save millions of lives in coming years as well. Please, sir, all of those SOPs really need to be followed in each and every hospital, because those are the major causes as well. For everybody who's out there, please make sure that you have your own shaving kit. You know, when you go to the barber, take your own kit as well. These are the precaution measures which you're supposed to take.
And not to forget that whenever you look forward to a doctor for an appointment, or you go to a salon or whatsoever, to the barber shop also, go for the sterilization. That it's very important. And over to Shehzad.
Exactly. Thank you very much for mentioning that as well. But for everybody who's out there, please make sure that you write to us on our Facebook page, which is with the name of World This Morning. On Twitter, it's World This Morning without a G. On Dailymotion and YouTube, it's World This Morning. The fabulous repeat is going to be at 4:05 in the afternoon. All right, ladies and gentlemen, please make sure that you tune in again if you have missed out on something. Till the next time, look after yourselves. 1, 2, 3. Good morning. Thank you, sir.